President Museveni announced HIV as a disease that was not only medical but affected all sectors of society. Therefore, he recommended the involvement of multiple actors in the control and prevention of HIV, creating a countrywide synergism that became the vital force behind Uganda's response. This government mobilization and empowerment opened up discussions about HIV and reproductive health that were previously taboo, helping to tackle the rampaging AIDS epidemic. Museveni relaxed controls on the media and various prevention messages spread throughout churches, schools, and communities. Posters, billboards, newspapers, radio shows, and commercials regarding HIV/AIDS were unavoidable during the late 80s and early 90s. In May of 1986, Uganda's Minister of Health attended the World Health Assembly in Geneva. At this time, he announced that AIDS was a serious problem in Uganda and requested the support of the international community. This was perceived as demeaning and detrimental to development by other African leaders that attended the event. This marked the beginning of Uganda's admirable response to the HIV epidemic that was not seen in any other sub-Saharan African nation.
I think the most important in Uganda was the massive involvement of government and the other partners, which is possibly different from other countries. Others took time to appreciate the epidemic, and many countries were denying it. But for us, we accepted it right away from the beginning.
Once the leaders take a lead, then they open up resources to the public for use. And our president was open, many including our neighbors. I must say, it's unfortunate. They are just coming on board of late. And there was denial, even among the political leaders. They thought that if you say that, if you opened up that to your country that it has HIV/AIDS, then there would be capital flight, donors would run away. But for Uganda, we said, okay, fine. So we can't just look on when our people are dying. Those who are ready to help us will come to our rescue, but we just can't look on. We can't hide. And good enough, the donors responded enormously. They came up in big numbers and joined us in hands. So the rest of the African countries eventually also woke up, realized that no, the only thing is to open up. Unfortunately, some of them, I'm sorry to mention, go down to Botswana, South Africa. By the time they woke up, the prevalence rates were already above 30%. And now they are continuing to increase, yet ours already have decreased. So the whole issue was about political commitment opening up.
The number of people living with HIV fell dramatically in the 1990s. It is controversial what specifically decreased the rates of HIV in Uganda. The decrease in prevalence cannot be attributed to one single factor. Incidence rates were decreasing while AIDS-related deaths were increasing, both contributing to the decline in HIV prevalence. However, multiple other countries in sub-Saharan Africa had similar patterns of HIV incidence and death, but did not experience a similar decline in prevalence. Despite the controversy, it is clear that there was impressive and monumental interventions that had a big impact on the people of Uganda. The government and community NGOs were heavily involved and changed the face of AIDS in Africa. The following 3 examples are only a taste of the interventions that exist in Uganda.
TASO is the largest local NGO providing HIV/AIDS services in Uganda. In the 1980s, HIV was associated with immorality and reckless behavior, and those infected were being stigmatized and discriminated against. Thus, TASO stepped in to restore the hope and improve the quality of life for persons living with HIV.
TASO started by a group of 16 members who wished to form what we could call a family support system to care for those who are HIV positive or affected by HIV and AIDS. It was started by a gentleman who was called Christopher Kareba, who tested HIV positive, and shortly before he died, that's when he developed the idea of starting an organization. So in 1997, the wife took on the vision of the husband to start an organization which we call TASO today. Their mode of serving the infected or affected was through the home visits. By their area of intervention was basically to offer counseling services whereby they could talk to somebody about HIV, and that is on the facts about HIV, how it is transmitted, how somebody can live with it for some good years, especially if they do what the doctors recommend them to do. So basically they wanted to counsel somebody and at the same time restore the hope.
TASO has come far, operating 11 centers across the country.
Each of these 11 centers are providing similar services. They are providing counseling, they are providing medical care, they are providing social support, and at the same time they are carrying out advocacy and networking with other organizations, especially fighting for the rights of those who are HIV positive.